Hello everyone, welcome to Move Well, Live Well. We've been having a number of people coming in with issues regarding their forearm. In particular, they're having pain in the forearm and right here where this insertion point right here. This is the lateral epicondyle of the humerus, the upper arm bone. This is the upper arm bone, this is the humerus. And right here, the lateral epicondyle of the humerus, it's having some tenderness, some pain in through there, and even pain in the forearm, tightness, trigger points in through the forearm. And what we're finding, this is lateral epicondylitis, which is also known as tennis elbow. So when tennis players would play tennis and they do the backhand, that backhand, as the ball hits the racket, there's a lot of shock wave in through that part of the forearm, and it all inserts right there on the lateral epicondyle of the humerus, the upper arm bone. Well, the wrist extensors, this is wrist extension. So if your wrist is like this is your wrist. As it extends, that extension point right here where they all these wrist extensor muscles, they insert right there. They extend the wrist. So what happens when they're playing tennis, those wrist extensors have to hold on to that racket. It has to, as that ricochet of the ball hits the racket, you just get the shock wave in through here. So we also see this in athletes, for instance, other athletes as well. You know, people, some professional weightlifters. We have weightlifters that come in here, and they're doing, for instance, the snatch. They got a nice wide grip, and as they come up in that position, as they come up for their pull, they're coming up in here, and they're starting to bend a little bit, a little too early, and you get a lot of tension and pressure as they go and do that. The triple extension to do that move, to get that weight, to get under that weight. Also, if you're doing the clean, weightlifters, Olympic weightlifting, where they're doing the clean, where they're pulling up, and that first pull, and they're starting to bend a little too early, and then they get that little tightness and tension and pain in through there. So that is lateral epicondylitis of the forearm pains, what they're getting. So one easy way to alleviate some of those issues in the forearm is to mobilize it a little bit. One great way, so if you're having problems with wrist extension, you're going to stretch it and put it into wrist flexion. So a great move is simply like this. You take your arm here, you take your wrist, and you put it into, again, this is wrist extension. So wrist extension. This is wrist flexion. So we're having problems with the extenders, and so what we want to do to mobilize this here, or stretch it out, or help it relax, we need to put it into flexion. So wrist flexion. So you make a kind of like you make a muscle. So you put your arm in flexion here. So this is elbow flexion and wrist flexion. And as you extend out, you keep this fist pointed towards you. Keep it in flexion. And then you're also adding a little bit of pressure here. Some pulling, you're pulling towards you, pulling pressure in through there as you extend the elbow. So now this is elbow extension with wrist flexion. Wrist flexion, elbow extension. So first they're both in flexion, elbow flexion, wrist flexion, and then as you extend the elbow, keep the wrist flexed right in through there. And man, you should feel a nice pull in through there. Now don't sit there in agony and force this sucker. Again, you want to do these to your tolerance. You don't want to sit there in agony and, oh man, you don't want to pull nothing or anything like that. What you're trying to do is just get these muscles in here relaxed so that way they perform better. So again, keep them in flexion, great stretch, keep elbow flexion, wrist flexion, and then keep, as you extend the elbow, you're going to keep this wrist in flexion. And you can kind of rotate a little bit and hit that muscle in different ways. So you can oscillate back and forth and through here and hit those wrist extensors in different ways. So again, this is the front view. As I extend the elbow, I'm keeping this wrist in flexion. And then you can oscillate in here in different directions to get that muscle hit in different ways. So that's one way you can do it. Another way you can do it is in here. So again, we're working the wrist extensors. So we want to stretch those guys. We want to put it into wrist flexion. So wrist flexion right there, and you're in here, just like this. And you're adding a little bit, you're keeping the elbow extended. And it's not a hard extension, it's not a lockout, it's a soft extension. So you got play in here. You see, I'm not in full lockout. It's got play in here. And remember, stretching should be a relaxing activity. You're trying to get that muscle to relax. And you can, again, you can move it in different directions. I'm going to put it like this so you can kind of see my hand. My hand now is pointing toward me, like this, pointing toward me. And I can sit back a little bit. I can kind of go to the side, hit it at different angles, right? I can do this way and then hit it at different angles, right? And really, you're just trying to find those tight areas within those wrist extensors. And once you find those tight areas, you just oscillate back and forth and find those. Another way you can do it is with either a lacrosse ball or a therapy ball. Grab one right here. So you can grab a therapy ball. This could be a lacrosse ball, could be a racket ball, whatever kind of ball you have around the house. And you can get in here and work these guys. You can kind of oscillate back and forth until you find a really tight, sensitive area. Kind of back and forth and through here. So right there, that's a little good spot for me too. Right in there. Right in there. Okay. And again, I usually recommend working your way distally, so farther, start far and work your way toward the heart. So distal to proximal, so away to here. I don't know if you can see that there. So I can take the ball. There. This could be a lacrosse ball as well. It's fine too. Just in here. And you're working here 3 to 5 minutes. Just to get those tight. Right there. It's kind of a little nasty right there for me. Just like that. Again, when you find a spot, you can oscillate back and forth just right on that spot. Just a nice tiny oscillation back and forth like that. You can even do a cross friction in through there a little bit. Again, you're doing this to tolerance. You're not sitting here in agony digging into that sucker. You're just finding those little tight areas and just kind of working that in there. You're kind of working it nice and gentle. Again, to your tolerance, so as you can tolerate. Right in there, that's a good spot for me right there. So again, we're having folks coming in with issues regarding their wrist extensors, and they all insert right there, and it can cause lateral epicondylitis or tennis elbow. Again, we see these a lot in athletes that play tennis, athletes that are doing Olympic weightlifting, where they're coming up in the clean, and as they come up on that first pull right here, that triple extension, they're breaking a little bit early, and their elbow starts to bend, and they're getting a lot of pressure through there. Same thing with a snatch. They start to bend a little too early in the elbow, and they're getting pain in through there. We sometimes see this too. You know, you got your weekend warriors, for instance. We had a patient come in here the other day, and they were grilling on their grill, doing this with the little tongs, you know, the little tongs, and they were just doing this. You know, flipping skewers on the grill for, you know, a number of minutes, and they're not used to that, and they came in with just discomfort and tightness into those wrist extensors just by doing this for however long that they were doing that this last weekend. And so they're having pain in through there. But so anyway, if you have any questions with some of the mobility and some of the techniques that we used here on this particular video, just drop them off in the comment section below. We thank you for watching. We appreciate it. Please like, subscribe, and share. And when you hit subscribe, make sure you hit that bell notifications button so that way you don't miss any videos coming in the near future. Anyway, we appreciate it. We thank you. We'll see you next time. Take care. Bye-bye.